So now the third philosophy in the RPDs or the philosophies of removable partial denture, that is your physiologic basing. So now till now we have discussed two philosophies, that is, first is conventional rigid design and second is stress equalization. Now the update from conventional rigid design to stress equalization was the amount of stress which are going to the abutment teeth should be broken so that the stresses are divided properly and there is no damage to the abutment teeth. Now there was one more problem which the proponents of the physiologic basing philosophy have suggested, that when the tissues and the teeth are compressing, suppose the teeth are compressing due to the presence of the periodontal ligament. Let us assume the compressibility value as 5. Similarly, the tissue ka compressibility value is 25. So there is difference of 20 values in the compressibility. Okay, this is just an hypothetical situation. Okay, so now to counteract this difference of 20, the proponents of the physiologic basing theory, what they are suggesting is, firstly what they pointed out the problem was the stress breakers are not the permanent solution. Okay, so for that we need to record the tissues in a functional form or in a compressed manner. So if you compress the tissues by 20, now what you are left with, 5 values remaining of tissue and 5 values remaining of the periodontal ligament or the teeth. Now when these both are 5, they both are getting compressed at the same rate. When this was 25 and 5, there was a difference. But if you are recording the impression such that you are compressing it by 20 and only 5 you are leaving it, then you have this equal number of 5 on both the sides, which is a more better or an advantageous situation compared to the previous philosophy. So the remedy was what? To record the tissues in the compressed manner. So that is how the physiologic basing theory was introduced. The main concept was to provide again equal stress distribution to the teeth component and the tissues component of the removable partial denture. Tissues are recorded in the functional form or in the compressed form by giving occlusal rod, or once you have made the RPD, then you reline the tissues using the functional stress, that is the occlusal stress. So their main part is, when you are recording the impression, what they are asking is to record the tissues in a compressed manner when you are taking the impression. If you are not able to do so, you make the whole RPD, reline that area in a compressed manner. So ultimately they want the tissues to be in a functional form or in the compressed form. That is what the physiologic basing theory says. But the disadvantage which occurs when you are recording the tissues in the functional form is that the tissues are continuously under the stress. So they will tend to rebound because they are compressing. Any soft thing which is compressed will tend to rebound. Secondly, and when they are in a continuous stress situation, in that time there is more amount of ridge resorption or tissue resorption which is seen in that type of condition. But due to this compressed state, the values are becoming equal, so there is less amount of load or forces which are acting onto the abutment teeth. So abutment is safe. Now the tissue is compromised in this theory. In the initial two philosophies or theories, the abutment teeth was compromised. Now they are behind the tissues, that you compress the tissue and let it get compromised. There are 4 main requirements of the physiologic basing philosophy. First is you need a rigid framework, that is the conventional rigid design. you need to incorporate occlusal rest and indirect retainer, because you are recording tissues in the compressed state. They tend to rebound. To stop that rebounds of the denture, you need proper occlusal rest and indirect retention. And lastly, broad coverage of the tissues. So the RPD should cover as much as area of the tissues as possible, so that the force is divided and not concentrated in a single area. So this is the whole mechanism. Revision: stress breakers not important, not the permanent solution. Why? Because the compressibility values are not same. So they suggested to record the tissues in compressed manner or in the functional form, right? That is where the physiologic basing theory came, to provide equal stress distribution to the teeth and to the tissues by recording the tissue in functional form, by giving occlusal load or by relining after the RPD is made. 4 main requirements: rigid framework, occlusal rest, indirect retention and broad coverage. Talking about the advantage over here, you get a good adaptation because you are compressing the tissues and recording them. It is simple and economical, no janjat or no problem of your stress breaker, hinge joint, ball and socket, split major connector, nothing is required. And minimal direct retention is required because now the load on the abutment is decreased. So you need not need more amount of clasp assembly or an extensive clasp assembly over here. Disadvantage again, decreases the retentive component, so the stability will be less, rebound can occur, and decrease amount of indirect retention. So again, these has disadvantages. We'll see what the fourth philosophy has to come up, whether it solves all the problems or all the disadvantages of this theory as well as the previous theory. That will come to know when we go through the fourth theory of philosophies of RPD designing. So the last and the final philosophy which we are going to discuss is the broad stress distribution. So now the name itself is explaining you about what is this philosophy going to say, right? Broad stress distribution. So the stress is distributed as much as broader into all the areas, so that not any one area, either the ridge or the edentulous area what we say, or the teeth will be in a compromised state. Till now all the three philosophies which we saw had some or the other disadvantage. Either the abutments or the remaining teeth were in the compromised state, or the tissue was in the compromised state. But now if we want to solve both the problems of compromising the strength or the state of the tissues, we need to consider the theory that is broad stress distribution. Okay, so in the broad stress distribution, as I said, the trauma which was happening to both the teeth and the tissues will be eliminated by covering as much as area by providing additional rest, additional clasp assembly and broad coverage by the denture base. So what you are doing, you are increasing the amount of occlusal rest, you are increasing the amount of direct retainers, that is the clasp, and you are trying to engage or extend your denture in as much as broader area. So what happens, just a small example, if this is a box, okay, and if I am putting a weight of 25 kgs, okay, this is a box made up of 4 individual squares, okay, and I have piled them such that it becomes a square structure, and I am giving a load of 25 kg, and this is not able to withstand, all the pieces are falling apart, or any 1 or 2 pieces are falling apart. Similar 4 boxes, small boxes, if I am keeping in one line and then keeping that 25 kg of weight, so what is happening is the stress is distributed broadly into all the areas, so that these four boxes cumulatively can take up the load of 25 kgs. whereas in this situation it was not possible. So this is what is broad stress distribution. You are increasing the number of occlusal rest, clasp assembly and the extent of your denture base areas to as much as possible, right? So this is about your broad stress distribution. Again, advantages would be the forces are evenly transmitted due to increase in what? The following components. As you are increasing the components, the contact of your RPD to all the areas is also increasing indirectly, right? So when you are increasing the contact with many areas, your horizontal stability is also enhanced, which was missing in the previous 3 theories or philosophies. And lastly, it is easy and economical to construct these kind of denture. It is not having any special component like a stress breaker, or you need not record the tissues in a compressed state, or it is not a fully rigid design. It is something which is practical and sound, easy and economical, and moreover you need not require frequent relining of the tissues also. Why? Because you have given a broader area for the forces to dissipate. There are very less changes which are going to occur into the soft tissue or into the hard tissue with the given amount of time. So in that case there is no frequent relining also required. When I talk about the disadvantage, as you give more number of clasp, occlusal rest, indirect retention, more bigger denture base, patient might not easily accept the denture. Patient wants something which is easy and confined. But over time, if you have a good rapport with the patient and you know how to manage the patient psychologically, you can surely rule out this disadvantage. Second is oral hygiene. As you have n number of components here and there, the food might get lost into various areas and the oral hygiene might become a bit difficult to maintain. In that case, you should be regularly monitoring this patient and also teach them the oral hygiene aids which are required to maintain for such kind of prosthesis. So the overall, starting with the conventional rigid design, or if you talk about stress distribution, okay, broad stress distribution, stress equalization, right? Any philosophy, all the philosophies are going to work good if you are well aware about the situation in which you are giving that philosophy. It is not that this philosophy is going to be used overall, no. There might be cases where you might have to give a conventional rigid design. There might be cases where you might have to go with a broad stress distribution philosophy. So your clinical knowledge about what is the situation demanding, what kind of philosophy is going to be successful for that situation is very important compared to the whole theoretical knowledge which we have gained in the 4 different philosophies, right? So ultimately it's your clinical as well as logical call which you make on which philosophy you want to go with. Yes, so pertaining to theory, these are the 4 different philosophies. I hope you guys have understood all the 4 philosophies thoroughly. If you still have any doubts or any queries, you can post them in the comment section, or what you can do is you can just ping on our Instagram page, that is PROSTHO. You can text us there also, right? So these are 2 areas where you can communicate with us directly. Hopefully we will not take much time to respond to your queries and questions. And at last, if you have enjoyed the video, please hit the like button, share button, and one more thing, don't forget to subscribe and hit the bell button so that every time we post a new video, you need not forget and you will be well notified before, right? And you should not miss that video too. Okay, thank you so much and see you in the next video.